A global pandemic means the sex workers of the world are facing difficulties. Protecting both their health and income is a hard balance to strike.
This is my only job that can earn enough money to support the family. Due to the lockdown, I lost all my income.
There is no effective way to protect yourself from the coronavirus. What should we do? Spray clients from head to toe with disinfectant? It's not profitable.
I just really have to wait until almost everything is opening. And then I go, because I want to cover myself as well. Because if someone gets sick in my dungeon, you know, I am not insured to that.
Like few other professions, their health and livelihood are on the line. And the varying degrees of legality and within which they operate provide another layer of vulnerability. Many in the sex work community are struggling to survive. Potential epidemiological superspreaders. That's what some German politicians called sex workers during the coronavirus outbreak. A label that's caused some pushback. Now that brothels and other establishments are reopening, we look at how the pandemic has been impacting a business that is the very opposite of social distancing.
Sex always sells, they say, a supposedly crisis-proof profession. But it's the very opposite of social distancing. So the coronavirus crisis has made life tough for those who make a living selling their bodies. The virus threatens the very core of their business.
Some of my guests have weakened immune systems, especially if they're a bit older. It makes you think, what if I were to infect them?
Germany's brothels had to close for a while amid a lockdown that's recently started to ease. But many of the country's estimated 400,000 sex workers live in a precarious economic situation anyway. The lockdown made their lives more difficult.
They haven't put any money aside. Their work was banned from one day to the next. It's very difficult.
This support centre for prostitutes is doing what it can to help women get by. But not all brothels have been allowed to reopen across Germany yet.
If you use the proper disinfection materials, what can go wrong? The beauty salons are open, the dentists are operating, so...
At this venue, efforts are being made to make sure surfaces are clean. But doctors say such measures won't keep customers or sex workers safe.
This hygiene plan is well meant, but considering how close the contacts are and how difficult it is to trace the customers, I really doubt it could work.
Meanwhile, COVID has rekindled a political debate about prostitution. 16 members of the German parliament launched a campaign to get it banned. They say the country's liberal laws have not protected women as they were intended to.
18 years on, we know it has totally failed. Germany is the brothel of Europe. We are a target country for European and worldwide trafficking of people for sexual exploitation.
Other politicians say all a ban ever does is push the problems into the shadows, beyond the reach of laws. And the coronavirus has proved that.
Right now, we are seeing that many women who can't work anymore because of the contact ban are being kept like animals, exploited by their customers. And that's what would happen if we tried to outlaw prostitution.
It's an old debate with new relevance because of the virus. For now, what most of the women say they're worried about is staying in work and staying safe.
For more, let's bring in Taina Bien-Aimé. She is the Executive Director of the Coalition Against Trafficking in Women. Welcome to the program. Countries are reopening their economies. Should sex workers also be allowed to get back to their jobs?
Well, this question is rather complicated because you are assuming that prostitution is work like any other, which we don't agree on. And also, this is not about simply the women in prostitution that we are talking about. We're talking about a system of exploitation. The situation of prostitution in Germany, which, as we all know, is legal, has contributed to a vast system of commercial sexual exploitation that includes countrywide brothels that make money from the trafficking and exploitation of the most vulnerable women from Eastern Europe and the global South. So the question that we need to ask is, should brothels not reopen? Because we know that brothel owners and brothel managers are part of a global multi-billion-dollar system of severe exploitation, of human rights violation that dehumanizes women and contributes to severe physical, psychological, and other harm.
Tiana, have coronavirus restrictions like closed borders had any impact on the trafficking of women and girls?
Well, the coronavirus has really put a spotlight on what happens to the most vulnerable, right? So I am in the United States. We see the inequality, economic, racial, and other inequalities that have been exacerbated by the coronavirus. It is exactly the same scenario for prostituted and sex trafficked women in Germany, where the borders are closed, women are on the street. And again, you know, if prostitution were a job like any other, people would register. Germany estimates that up to between 200 and 400,000 women and a few men and trans women are in prostitution. Only 39 have registered with the government. That says something to the German government. That says that the laws will not eliminate the stigma attached to prostitution, and also they truly fail to examine who the human beings are who are being bought and sold by men. And it's also, how are you going to exercise safety measures that all of the health institutions have given us under the corona guidelines when it comes to exchange of bodily fluids and all of the other sexual acts that are involved in prostitution. It is absolutely impossible.
Of the Coalition Against Trafficking in Women. We have to leave it there. Thank you for speaking to us.
Thank you.
Next up are your questions about the novel coronavirus and our science correspondent Derek Williams answering them.
What about people testing positive weeks or even months after a first positive PCR test? What does this mean?
Some people continue to test positive for the virus long after coming down with the disease. And to be honest, we still don't really know what that means. The problem is that a PCR test only detects SARS-CoV-2's genetic material, its RNA, but it doesn't say anything about whether or not that DNA is coming from viable virus. To find that out, you have to culture a sample from the positive patient, which is laborious and time-consuming because the sample is potentially infectious. But where that's been done, the indications are that the virus that PCR tests detect in long-term positive patients, that those viruses are not able to replicate. So many experts now think that although some people clearly take longer to get the virus out of their systems, that doesn't mean that they're infectious for weeks on end.
Is there a risk that a COVID-19 vaccine could trigger an autoimmune disorder like lupus?
You know, no matter what you answer on a question like this, someone is going to end up screaming at you. So I'm going to go with the World Health Organization's website on the issue of adverse reactions to vaccines, which would include things like the development of an autoimmune disorder after being vaccinated. The WHO says that very rarely serious adverse effects to vaccines do occur, But despite that, there's no question the benefits of vaccination very much outweigh the risks. So could our theoretical COVID-19 vaccine theoretically trigger an autoimmune disorder? Yes, I guess so, but the chance is likely to be very slight, and the upside of acquiring even partial immunity to COVID-19 through a vaccine would be huge, assuming, of course, that the vaccine candidate has been properly tested.
On June the 15th, travel restrictions on Germans leaving the country will be lifted. Is it also reopening its borders to EU nationals?
In the course of its lockdown, Germany introduced bans for most non-essential travel, and some of them will continue through June 15th, although cross-border traffic routes have already been reopened and the checks are no longer really systematic. The country's interior ministry has stated that it's now planning to also lift those bans on that date for travelers from other EU member states, as well as from Britain, from Iceland, from Norway, from Liechtenstein, and from Switzerland, as long as lockdowns and travel bans have also eased in those countries. German health officials will be keeping a close eye on coronavirus-related activity, though. So there's a chance those plans will change if things also change on the ground somewhere in Europe. It's still a pretty fluid situation.